the differences between brand medication and generic ones. Why so much differences in prices? Did you know that the cost of a brand name medication can be up to 85% higher than its generic counterpart? Why such a huge difference for the same treatment? Let's break it down today. Hi, I'm Nicholas and welcome back to MedEd, Pharmacists in Focus, okay? This is where we simplify pharmacy and healthcare topics to help you make smarter health choices, okay? So, in this video, we will unravel the mystery behind the pricing gap between brand name and generic medications. And we'll also explain why the differences exist and help you feel confident about your medication choices. So, I would request you to stay tuned to learn some insider pharmacy knowledge. Okay? Let's begin. Imagine you've just been prescribed a medication and your pharmacist offers you two choices. A brand name drug for $200, that is 25 Kenya shillings, or a generic version for $20, that is 2,600 shillings. Both treat the same condition, but you are left wondering, what is the real difference? Are you sacrificing quality for a lower price? Let's explore. So what are brand and generic medications? Let's start by defining the parent drug. I mean brand name medications. So brand name medications represent the original breakthroughs in drug development. These are the first versions of medications created by pharmaceutical companies, often after years of rigorous research and testing. To protect their efforts and investments, companies are granted a patent with authorities, okay, which typically lasts 20 years from the date of filing. This patent gives the company exclusive rights to produce and sell the drug during this period. Think of it like a movie studio releasing a blockbuster film. They hold exclusive rights to that film for a time before it becomes available on other platforms. The patent ensures that competitors cannot copy their blockbuster, in this regard the medication, until the exclusivity period ends. So creating a brand name medication isn't just about mixing chemicals. It's about groundbreaking science. Okay, it's about groundbreaking science. So companies pour billions of dollars into developing these drugs, conducting preclinical studies, and running clinical trials across multiple phases to ensure safety and effectiveness. This process can take over a decade and involves thousands of researchers, doctors, and other participants, okay? The result is a drug that's proven to work but comes with a high price due to the immense resources invested. So once developed, these medications, I mean the brand name medications, don't sell themselves. Pharmaceutical companies invest heavily in marketing to educate healthcare providers and the public about their benefits. Whether it is through advertising campaigns, free sample to doctors, or sponsoring medical conferences, these efforts add to the overall cost of the medication. On the other hand, what are the generic medications? So, once the patent on a brand name drug expires, other pharmaceutical companies are allowed to manufacture and sell their version. They are allowed to manufacture and sell the versions of the medication, the brand name medication. These are known as the generic drugs, okay? Think of it like a popular tech gadget. When the original design patent expires, other companies can create similar products, often at a fraction of the cost, okay? So generics capitalize on the groundwork laid by the brand name drug, okay? So this makes them this makes them more affordable. This makes them a more affordable option for consumers. The generics required by the regulatory bodies like the FDA to be by equivalence, okay, to their brand name counterparts. This means that they must have the same active ingredient, strength, dosage form, and route of administration. Imagine you are baking a cake from a famous recipe. Even if you use a different brand of flour or sugar, as long as you follow the recipe's key ingredients and steps, the end result is the same delicious cake. Similarly, generics deliver the same therapeutic effect as the brand name medications, ensuring that patients receive the treatment they need. Right? So without the burden of extensive research and development and marketing costs, generic manufacturers can offer their medication at significantly low prices compared to the brand name products. While they don't have the same brand recognition, generics provide an accessible and reliable solution for millions of patients. Rest assured, they are not counterfeits. Generics undergo strict regulatory scrutiny to ensure they meet the same quality, safety, and efficacy standards as brand name drugs. So, why the price difference? The price difference between brand name drugs and their generic counterparts often raises questions. Let us break it down by examining three key factors. That is research and development, marketing, and market competition. So I will start by research and development cost of the brand name medications. Brand name medications have a high research and development cost for the reasons I explained above earlier, okay? So developing a new drug is an expensive and lengthy process. On average, it can cost between $800 million and over $2 billion to bring a single drug to market. Why is this costly? The process involves multiple stages, okay? The first stage is preclinical studies. These are conducted in laboratories and on animals to assess the safety and efficacy of the drug before human trials begin. The second one is clinical trials. So each phase involves testing the drug on humans with increasing numbers of participants to ensure safety, and also determine dosage and confirm effectiveness. The third one is regulatory approvals. After years of research and the data is submitted to regulatory bodies like the FDA or EMA. In this regard, in Kenya is Pharmacy and Poison Board, which meticulously review it before granting approval for it to access the market. Okay, so this investment must be recouped by the pharmaceutical company, and the cost is passed on to consumers through higher drug prices. This is the reason as to why these brand medications are so expensive. So how about the generics? Why are they cheaper compared to their brand name counterparts? This is the reason as to why generics save on. This is the reason as to why. Okay, so generics save on research and development. Generic drug manufacturers take a different approach. Instead of developing a drug from scratch, they use an already approved formula from the brand name medication. Their primary responsibility is to prove bioequivalence, which means the generic works the same way in the body as the brand name drug, okay, as their parent drug. So by skipping the initial research and development process, generics avoid billions in cost, allowing them to sell their products at significantly lower prices. The generic drugs manufacturers benefit from the established reputation of the brand name drug, okay? So they don't spend a lot of money in marketing. Patients and healthcare providers already trust the efficacy of the formula, so there is little need for expensive advertising and also the advertising campaigns, okay? So this keeps marketing expenses low, contributing to the lower prices of the generics. How market and competition affect the difference in prices of this medication? How does it affect? Okay, there is limited competition for brand name drugs when it is introduced in the market. When a new drug is developed, the manufacturers receive a patent granting them exclusive rights to sell the drug for a set period, typically 20 years from the time of patent filing. So during this time, they face no competition, okay, allowing them to set high prices to recover their investment and generate profits. Regarding the generics, there is increased competition for the generics. So once a brand name drug's patent expires, generic manufacturers can enter the market. Unlike the original manufacturer, generics don't have to recover the research and development or marketing costs, allowing them to sell at much lower prices. As multiple generics becomes available, the competition among the manufacturers drives prices down even further. That's why the generics are very cheap. Okay? So this competitive environment benefits consumers by offering the same treatment option at a fraction of the cost. For example, a brand name drug that once cost $300, that is almost 30-something thousand shillings per month, may have a generic equivalent available for as little as $30 or even less. Okay? The significant price difference between brand name drugs and generic is primarily due to the cost associated with research and development, marketing, and other dynamics of market competition. Okay, so while brand name drugs are vital for innovation, generics play an equally important role in marketing, in making healthcare more accessible and affordable. So we've uncovered the reasons behind the big price difference between brand name drugs and the generics. The generics, okay. So from research and development to market competition, okay. But here is something that's on a lot of minds. Are generics really just as effective as their brand name? Well, in the next video, I'll dive deeper into the rigorous standards that generics must meet to ensure they are just as safe and effective. Trust me, you won't want to miss it. Stay tuned and see you in the next video. Bye bye.